Hello Nigerians, it's World Cancer Day and that is why I'm all dressed in pink. In 1991, cancer survivor Charlotte Hadley sent pink ribbons to raise awareness on cancer, and that is why pink today represents cancer. We are here today at the Lagos University Teaching Hospital to speak with an expert on cancer. Stay with me. My name is Ajayi Luabumi and this is Alakada TV.
It's Dr. ALABI. I'm a clinical and radiation oncologist at the Lagos University Teaching Hospital. This is the NSI Louth Cancer Center, which is located in Louth here, and here we manage cancer patients. So I'm a clinical and radiation oncologist at the center. A growth, and we qualify by saying it's an abnormal growth. So it's something that shouldn't be located where it finds itself. So it's an abnormal growth that grows in an abnormal way and can also spread in an abnormal fashion. So sometimes we have growths in the body which may not really be cancer, and these are the ones we call benign tumors. So for cancer, tumors are growths or swellings or lump. People have different names for it. That when you find it in the body, they are problematic, because they have the chances of spreading to another part of the body which you don't want them to spread to. And so because of that, they are classified as neoplasias, abnormal neoplasias that grow and have the tendency to metastasize, that's to spread to other parts of the body. So that's basically what cancer is. Look at it in different angles. We can say children cancers, we can say adult cancers. So because cancer can affect any age group. It can affect children less than 1. It can also affect adults 80 years and above. So cancers can affect different age groups. And when we now say different types, so we say, okay, in children we have some common cancers, like cancers of the eye called retinoblastoma, cancers of soft tissue like the rhabdomyosarcomas, cancers of the kidney in children, we call that Wilms tumor. That's just a few of the cancers in children. And for the adults, we have the cancers categorized into maybe females or males. So for the female cancers, we'll talk about the common ones now. We say breast cancer, cervical cancer, colon cancers, head and neck cancers, lung cancers. And for the males, we talk about prostate cancer. That's the commonest in our environment. And we also talk about lung cancers, colon cancers, head and neck cancers. So cancers are of different types. So we can look at them in terms of children or adults, or in terms of males or females. So these are the different types. So virtually every cell or every organ in the body can have cancer. Just very few places cannot or has not been documented to have cancers, like the hair, the teeth, the nails. So we don't have cancers of those places, but virtually everywhere in the body, cancer can grow. The symptoms, they vary from individual to individual, but some of the commonest symptoms that we have for breast cancer includes a breast lump. So the woman will usually say, oh, I noticed the swelling which was never there before, and it appears to be getting bigger, or it's still the same size but it's never been there before. So breast lump. They can also have symptoms of change in coloration of the skin or the texture of the skin. Sometimes it can go to the extent that the skin begins to look like the skin of an orange. So we call that peeled orange. And sometimes the nipple can discharge. So some women can have nipple discharge. It could be bloody, it could be brownish. So, but not all nipple discharge signifies cancer. Or some nipple discharge, so any nipple discharge should actually be related to the doctor, so that the doctor can find out why the person is having that kind of discharge. Some other symptoms may be swelling in the armpits. The woman will just notice a swelling in the armpits which is getting bigger or just there, but that may also need to be evaluated or looked on. So breast cancer usually involves the breast getting bigger, change in skin, change in coloration, and or dimpling, or there may be a dimpling, or there may be inversion of the nipple. The nipple may become retracted inside. So when the cancer may have become a little bit advanced, There may be ulceration, there may be wound over the skin. And the person can also present with symptoms of cough, chest pain, abdominal pain, yellow eyes, if the cancer has spread to some other parts of the body. So basically that's the symptom for breast cancer. So looking at the symptoms for cervical cancer affects the neck of the womb in a woman. And one of the commonest symptoms they present with is to have bleeding, abnormal bleeding from the vagina. So let's say, for example, a woman who has stopped menstruating or seeing her period now begins to suddenly see her period. That may not be normal. Or a woman who menstruates normally or now has some abnormal vaginal bleeding, that may also signify something. Or post-coitus, they begin to see blood, so that may also be. So any abnormal vaginal bleeding may be because the person has cervical cancer. Other symptoms that are classic with cervical cancers include watery vaginal discharge. There's just water coming from the vagina and it's usually foul smelling. So that can also be a symptom. So other symptoms that we find in them may be abdominal swelling, abdominal pain. They may begin to lose weight, may begin to lose weight, and basically those are some of the things they present with. Are in different categories. So, and there are so many factors we look at. We want to see the stage. We want to stage how early has this person come. So if a breast cancer patient comes and is an early stage, so we may need to remove the tumor. So we're talking about after diagnosis has been made now. So we may need to have the tumor removed, and this can be in form of doing a wide local excision, or doing a breast conserving surgery, or doing a mastectomy if it is a later stage. So not every time do we have to do a mastectomy for patients with breast cancer. Sometimes you just need to take out the lump by a specialized breast surgeon, a specialist, the breast surgeon. So because they know what to do, they know what to remove. And so surgery is a part of their treatment. Other parts of their treatment includes chemotherapy. So sometimes they need to undergo sessions of chemotherapy. These are cancer drugs that work in a fashion to go around the body to kill the cancer cells wherever they are. You remember I said the cancer is such that it can move from one part of the body to another and it can spread. And so we don't want it to spread. And sometimes you are seeing it in that small location of the breast. You don't know whether it has gone anywhere. So chemotherapy are cancer drugs that go around the body to affect the cells wherever they are, to destroy the cancer cells, so that you can help the patient achieve some level of cure. So other treatment that they have is radiotherapy. So radiotherapy is cancer machine. It involves the use of radiation by a special machine to treat cancer cells that are found around the breast area. So the chest wall or the armpit, where the cancer cell most likely can be hiding. So that's one form of treatment. So there are some other forms of treatment like hormonal therapy, targeted therapy for breast cancer patients. So we look at so many factors when the woman comes. We look at what that type of breast cancer language is speaking, so that we'll know what treatment will be best for the patient. For cervical cancer, usually we recommend surgery for those who come in early, and after surgery they may need to have radiation therapy. That's the radiotherapy with the cancer machine, using radiation. And then for those who come in at a later stage, they will benefit from what we call chemoradiation. So chemoradiation involves giving small doses of chemotherapy on a weekly basis, in addition with undergoing the radiation machine, the radiotherapy machine. So radiotherapy machine treatment is treatment they come for every day. They spend like 5-10 minutes under the machine and they are done for the day, but they need to have the radiation delivered to the part of the body being treated every day for a couple of weeks. So that's the radiation treatment. So by and large, we have some other treatments that are not main or may not really apply to everybody. So, but they're also part of treatment that they have to go through. For World Cancer Day, so many activities are ongoing now. So many of the NGOs, which I know they have programs put in place to increase level of awareness, to increase advocacy, to increase screening modalities. So some are offering free screening services so because we usually say early detection saves lives. And so when we're able to screen people and detect on time that there's a lump in this woman or there's a risk of cervical cancer in this person, so we can offer quality treatment that will prevent the person from having an invasive cancer. And so, having said that, the NGOs are doing a lot now. So many of them are around in Lagos here. Some are in Abuja. They've organized walks. They've organized training sessions. They've organized so many things to help us to improve the level of awareness and advocacy for cervical cancer. The government, on the other hand, has also organized some virtual symposiums to address the issue of cancers and how we can tackle it, to ensure that we have more infrastructure for treatments. Like radiotherapy services are not available in every part of the country. Just in very few regions can you have radiotherapy services. And so because of that, the government is also making efforts to arrange for meetings, and promises have been made on how to get all these centers well equipped to manage cancer treatment. So one of the things that the government is also putting forward now is that the World Health Organization has a program to eliminate or eradicate the federal government of Nigeria too has taken keen interest in. And so they are increasing the level of awareness, increasing screening modalities for cervical cancers. And so that is what we have on ground now. Lifestyle modifications are important. So because some of these cancers are as a result of our diet, as a result of obesity, not exercising well enough, increased BMIs, hypertension, diabetes. And so if we look at all these categories of diseases that make one prone to having cancer, or the kind of foods we eat now, when trying to imbibe the Western world, their diets, a lot of fast food now, a lot of eating canned food. So all those things are in one way or the other affecting us. And not only are they affecting us, they're also increasing our incidence rates for cancers. So we never used to have this huge volume of cancer patients, but now we're beginning to have a huge number of cancer patients, and these are the reasons. And so every one of us needs to take an extra step, extra precaution to say and ask yourself, what do I need to do to maintain a healthy lifestyle? And so this involves exercises. So in this part of the world, we're not used to doing exercises. We're all after means of livelihood, survival. So we need to now tell ourselves we need to do some form of exercises. We need to eat healthy. Eating healthy, we don't really like saying, oh, eat this and don't eat this. So but when we say eat healthy foods that your body can easily digest, healthy foods that your body can easily make use of. So these are our own way of saying we need to have a good and have rest. So we need to know when to tell our body it's time to rest. Sometimes some studies have actually shown that cancer is associated with stress. So areas that you have people who undergo a lot of stress, the risk of having cancers is high in them. So you see that living healthy and trying to maintain a healthy lifestyle is something that is encompassing and involves so many of these things of ensuring that you stay away from stress. If you need to take time off, the body is not a machine, take time off to rest and get yourself back together again.